Hello, dear ITI members. Welcome to episode 3 of our dental photography intro series. My name is Alessandro Devigus. In episode 2, we covered the camera and the macro lens. Today, we add the element that most dentists underestimate, light. Because in dental photography, light is not decoration. Light is what makes your image clear, repeatable, and clinically useful. Let's start with a simple truth. The mouth is one of the most difficult environments in all of photography. It is small, it is dark, it is reflected. Let's say the teeth are reflected. And it's wet. Saliva reflects light, enamel reflects light, mirrors reflect light, and every patient has a different anatomy, a different opening, a different position. If you rely on ambient light, the room light, the operatory lamp, the window, you will get a different result every single time. And that is the opposite of what we want in clinical photography. We want repeatable images, same exposure, same color, same look. Today, next week, 5 years from now. And that only happens with controlled, dedicated light. You might ask, why a flash and not just a stronger loom light or operatory light? 3 reasons. First, a flash freezes motion. Even when you think you're still, you move. The patient breathes, the mirror shifts. A flash gives you a fraction of a millisecond of light and your image becomes sharp. Second, a flash standardizes exposure. When you use the same flash at the same setting and the same distance, you get the same brightness every time. That is what makes images comparable. Third, a flash neutralizes ambient light. The operatory lamp is warm, the window is cool, the ceiling light is somewhere in between. A flash overpowers all of that and gives you one consistent color temperature, usually around 5,300 Kelvin, which is close to daylight. So the flash is not just more light, the flash is controlling light. My recommendation, begin with a ring flash. And here's something most people don't know. The ring flash was not invented by a camera company. It was invented by a dentist. Dr. Lester Dine in the United States developed the first ring flash in the early 1950s, specifically to solve the problem we just talked about. How do you get even light into the mouth without shadows, without glare, without compromise? So when you mount a ring flash on your macro lens today, you're using a tool that was born in a dental practice by a colleague for colleagues. I found that worth remembering. Now, why does it work so well? A ring flash sits around the front of your macro lens and gives you even frontal illumination across the whole field. It is forgiving. You don't have to think about flash position. You don't have to balance 2 light sources. You point, you focus, you shoot, and you get a clean, well-exposed clinical image. It is also excellent for occlusal views where you need light to reach deep into the arch. Is a ring flash the most artistic light? No. It is the most reliable starting point for standardized documentation? Absolutely yes. Master the ring flash first and then go the next step. Once you feel comfortable with the ring flash, the next step is a twin flash or lateral flash setup. 2 small flashes mounted on the side of the lens or on a bracket like here give you directional light, and directional light is what reveals surface texture, translucency, and 3-dimensional shape. This matters when you start working on anterior aesthetic cases, lab communication for ceramics, before and after documentation where shape and surface tell the story. A ring flash might flatten the 2 surfaces. A lateral flash makes it really look 3D. Both are useful. They just answer different questions. For pure documentation, ring flash is more than enough. For aesthetic and ceramic work, I would go for lateral flashes because they then become essential. Now, a quick word on the trend you have certainly seen on social media. In the last few years, more and more dentists are experimenting with diffusers, bouncers, softboxes on their flash systems. The idea is simple. Take the hard light from a flash and soften it to create more flattering portraits and more natural-looking aesthetic photography. Some of these setups produce nice results. Others are pure marketing. This is a topic that deserves its own episode because the differences between a real softbox effect, a small bouncer, a clip-on diffuser are bigger than most people think. So we will dedicate a full episode to light modifiers later in this series. For now, let's focus on mastering your flash first. The modifier only helps if the base light is already under control. Let me give you the sequence again because it is the foundation of this whole series. The camera captures the image, the macro lens captures the detail, the flash creates the consistency. Take away the flash and the system collapses. You will have sharp images that look different every day. This is why I always say don't spend money on a more expensive camera body before you have invested in the lens and the proper flash. A mid-range mirrorless body with a macro lens and a good flash will beat a top-end camera with no flash every time. Here's your quick win for today. If you use a flash, you can and you should lock your camera settings. For most clinical documentation, this is a reliable starting point. ISO, low, aperture 22 or 25, shutter speed 1/160 of a second, white balance 5300 Kelvin or 5100 for Godox shooter. These settings give you maximum depth of field, frozen motion, and neutral color every time. Set them once, save them as a custom preset on your camera. Stop changing them between patients. That single decision will transform the consistency of your documentation overnight. Now, I want to hear from you. What is your biggest problem with lighting in dental photography? Is it too much reflection on the teeth, dark images in posterior region, overexposed anterior shots, shadows from the mirror, inconsistent color from one visit to the next? And if you want me to cover diffusers, bouncers, and softboxes sooner rather than later, tell me in the comments. Demand decides the order of this series. Write your question, I read everyone, and I will feature the answers in one of the next episodes. See you in episode 4, where we move into standard views and protocols, the framework that brings everything together. Voila!